and welcome to the June edition of HR Hot Topics. I'm your host, Jody Schaefer, and as always, we aim to make this the most informative 5 minutes of your month, but I'm going to tell you right now, this is probably going to be 10 minutes long because I'm talking about the new MIOSHA workplace rules, and in some sense, it's been streamlined and it gives more choice to the employer, more flexibility, but in another sense, it's created a lot of uncertainty for employers, and so I want to talk through some of the key changes and some of those decision points. This is a struggle. I mean, if you could see how much paper I have in front of me right now trying to make sense of the MIOSHA rules, which govern workplace safety, so that employer-employee relationship, versus the Michigan Department of Health and Human Services public health order, which talks about some of the same things, but that's focused on general public and places of public accommodation. It can get confusing. And then there's a separate carve out for healthcare employers, and some of these rules do apply and some don't, depending on whether or not a patient is present. So just a lot to digest today. I'm going to jump right in. MIOSHA came out with revisions to their COVID emergency rules, and those changes took effect May 24th, and they'll be in place through October 14th. So that's a different timeline than the Michigan Department of Health and Human Services public health order, which is set to expire on July 1. So we've got different timelines going here and different targets of these orders. So the MIOSHA rules, they streamline all of the prior rules and really put them into 8 rules. So I've got them in front of me here. The first 2 rules set definitions and kind of the stage. So it's really 6 rules that we're looking at. And as I said, it gives a lot of flexibility to employers. So I just want to highlight a couple of the key changes here. The first is that you still have to have a COVID-19 preparedness and response plan. That's always been a rule. That's still a rule. But what is in that plan has changed. So I'll include some of those changes in the email below just to keep the video on time here. One note, though, the Small Business Association of Michigan, which offered a free template for this preparedness and response plan at the start of the pandemic and has been updating that template all along, they have come out with a new template that has all of the new updates. So it might be worth your time to check that out. I'll include a link in the message below. So the plan is important, and it's streamlined, obviously allows for in-person work as of the 24th of May. So you may have staff coming back to the office for the first time. And that creates a lot of questions around whether or not you have to wear a mask. And that's really the crux of a lot of this. Do you have to wear a mask? So you've got the CDC that came out and said, if you're fully vaccinated, no masks. Well, that came as a surprise to all of us. It sort of came out of left field. And so the states were left scrambling, especially a state like ours that had a lot of restrictions in place. So we're kind of left scrambling, trying to figure out how we align our rules with new CDC guidance. And so you saw that public health order come out, and then you saw MIOSHA come out with their revised rules around masks. And basically what it says is this: if you are fully vaccinated, as an employee, you do not have to wear a mask in the workplace, regardless of how close you are to someone else. So you're kind of immune from the mask requirement and the social distancing requirement, unless your employer indicates otherwise. So as private employers, you still get to make rules around what happens in your workplace, both for your employees and for anybody coming through your front door, so long as you communicate those rules in advance. So you could comply with the revised MIOSHA rules and say, for fully vaccinated folks, both patients, customers, and employees, if you're fully vaccinated, you don't have to wear a mask. Now, it's important to note here, natural immunity does not count as fully vaccinated. So if you have had COVID and recovered, but not received the actual vaccine, you are not falling under this carve out for masks. You have to have had the vaccine, and then you don't have to wear your mask again if your employer allows it. Okay? Well, for some of you, that creates this division within your workplace. And I have many clients that are not comfortable with that. So they're going one of 2 routes. Either they're requiring everybody to continue wearing their mask, regardless of vaccination status. You can do that. You can always require more than what the law does. Or they're going the other route and saying, Nobody has to wear the mask unless you are within 6 feet of somebody else. And then everybody, regardless of vaccination status, has to put the mask on. And that also complies with the new MIOSHA rules. So the unvaccinated folks only have to wear the mask if they're within 6 feet of someone else. So you could swing that way too. But I do have some employers that are trying to incentivize vaccination, and they want to give credit or reward to those that have done it. And so they're going to comply with this as written and say, if you are fully vaccinated, you're going to show me your vaccination card. Yes, you can ask for that. And that's my proof that you are fully vaccinated, and you don't have to wear your mask. And if you're not fully vaccinated, you have to wear your mask in all settings. I mean, that is another option, right? So this is kind of the struggle and the challenge. And I've seen this go both ways. As a consumer walking into places, are employees wearing masks or not? And it's a challenge, quite honestly, because I think whatever way you go, you should be involving your staff in that decision making. I think you need to have an understanding of where your staff are at in terms of vaccination status, what their fears and concerns are in terms of working alongside coworkers. I mean, certainly employees always have the ability to wear a mask if they want to. If it just makes them feel better, they can always put one on. But you're kind of trying to decide between that. So, think through that. In the healthcare setting, you have to wear the mask if you are around patients, right? Even if you're fully vaccinated. So a little bit different carve out there on the healthcare setting. But the mask is the big one. Another couple of changes I'm just going to point out quickly here. Physical barriers are no longer required in the workplace. So if you have them and you like them and they make sense, you can keep them, but you don't have to have them anymore. The COVID workplace safety coordinators still required, but they don't have to be on site all of the time anymore. So you have to have a couple of folks that people know they can go to if they have questions, but those people don't have to be physically on site all of the time. Let's see what else is an important one here. If you're in a healthcare setting, you can reopen your waiting rooms so long as you can keep patients 6 feet apart. You can ask your patients for proof of vaccination if you want to allow them to unmask. That's up to you. That's your call. Let me see if there's just a few other things. Oh, health screening. Health screening is still required for all of your employees and contractors regardless of vaccination status. So you still have to do health screenings. For my folks in healthcare, you no longer have to take temperatures though, and you need to retain those health screening forms for 6 months. I think those are the big ones. Really, it's going to be MIOSHA complaints that drive enforcement. Just for those of you that are interested, MIOSHA has received 15,000 workplace complaints from employees in the last 15 months. That's a huge number. So just know whatever decision you make here, and that's why I say involve your staff, get their feedback, be very open and transparent about the MIOSHA rules so that they know you're not just making this up. Take their concerns into consideration, because if they don't like what you've decided to do, they have an easy complaint process, and that's when MIOSHA is going to come in, and the first thing they're going to ask you for is your COVID preparedness and response plan. So you want to make sure that you have that and that it's updated. So I'll put a lot of this information in the body of the email. I would encourage you to reach out to colleagues that are in your industry and find out what they are doing around this mask component. I think people's tolerance and comfort level around this will change as the weeks go by. But it's really challenging right now, and I don't think there's any right answer. It just means you have more choice to try to make a decision that makes sense for your workplace based on risk, based on exposure, and perhaps based on vaccination status of those on your team. So with that, I'll leave you. Again, if you have any questions, you can reach me directly, Jody Schaefer at workwithhrm.com.